The deepest bonds are spaces where vulnerability is welcome. Good friendships have a reciprocal quality. When either person is experiencing struggle, the other is ready to hold space, to listen without judgment, and with a heart full of compassion. Meaningful friendships contain a bond that rises above competition. We feel a friend's victory as if it were our own. True sympathetic joy, the joy we feel for the success of another, is the absence of jealousy.
The skill of just being able to listen to someone's problem or angst or frustration or whatever it is and not necessarily advise but just listen is quite a skill that some people prioritize and some people don't. Like, I know for me, for example, when I've spoken about the things my parents have done with people outside of I say outside of my circle, but also this applies to some people inside my circle, it has been met with silence or explanations of my parents' actions.
Yes, yeah.
Or justifications, you know, just so many other things that are not actually just listening with compassion. And then that often then leads to, the advice giving. Listening with compassion is really listening without any judgment of what I think is happening in that situation. Because that could take away from the compassion I show to that person. For example, someone may be talking to me about a problem in their friendship that I already know about and have arrived at certain judgments about, and then may talk to me about how that friend is treating them. I may have already decided in my mind that the person who's telling me about the problem is at fault, in which case that would really shape the way I have that conversation with them. So in order for me to really listen with compassion to somebody, I have to remove any preconceived ideas of what I want from this outcome or what I think should happen, or, you know, I just have to really detach myself in that way. I think in how you make someone feel listened to, eye contact, body language, touch if appropriate, responding when people are like in pain, like when someone is talking about something that is very painful for them, you know, responding to that in however I see fit at the time, and even just and ahs and the way you use like your voice and your words to show empathy with that person. Even what you say, like just I hear you, I'm listening, like reiterating to that person, I feel you, like, you know, using those kinds of words and phrases.
It's validating someone's experience for what it is without putting yourself in it.
Yeah, exactly. Yeah, exactly.
I think Akadi asked me a similar question, or I was talking about when I'm in pain, I want people to lean into compassion and not curiosity. I mean, don't get me wrong, I'm a curious person, I love curiosity, but when I'm in it and in that pain, the curiosity of the answers that you may want for yourself as the other person in the conversation can be triggering to people. And it was triggering for me when people are asking me questions for their own curiosity. And I may not want to answer those questions.
So part of showing compassion is also then being conscious of your curiosity, isn't it? And how you ask questions and guide the conversation.
Yeah, being conscious
about the person who's doing the disclosing and the talking.
Yeah, so then maybe it is being more conscious of yourself when you are holding space for someone else. Being more conscious of how you ask questions or how you are in that space yourself. And it takes an extra level of attention and care.
Also, I find what people do a lot when they're listening to me talk about my parents is I can notice when they are bringing their parents and their relationship with their parents into the conversation. So say, for example, someone has like recently lost a parent, the conversation will be like, oh, but at least you have two parents. But they won't say it directly in that way. I will just be aware that it's happening. It really takes a lot of removing yourself from your previous experiences and your judgments, and trying to listen with as open a mind as possible. When people say to me, oh my God, that is awful, when they listen to what I've had to endure with my parents, I notice that, because that's not the common thing. So I actually notice when someone is listening with true compassion very quickly, because that's not the norm.
Do you mean that feels validating when...
No, that just feels like a normal reaction when someone is talking about something that has been very painful or harmful, because that's not the norm that I'm used to. I'm not sure I feel validated. I might have 5-10 years ago. Whereas now I'm seeking that less, because I already know what I faced wasn't okay. But there was a time where I did need that. I didn't get that. Why were we do you think you can train people just to listen with compassion?
It's not what medical school is about. Training compassion, training empathy.
Yeah. I've always felt conflicted by that. I've always felt conflicted by... the way med school teaches it is in a very specific way. But when you're observing a consultant or observing your registrar have a difficult conversation, or you're observing a GP in clinic, I just remember every single time I have seen compassion practiced that comes from training, I can see through it. And
you can.
If we can see through it, then patients can see through it.
You can feel when someone is saying something to you and doesn't mean it. You can feel that. But often it is just speaking what feels most natural to you. The problem with medicine and being a doctor is you are taught to play a role. And at times it can be a performance. So doing what is natural to us isn't always what happens. So ironically, teaching it in that way takes you further away from authenticity. Ultimately, just be there in whatever ways feel authentic to you. Listening is speaking less.
It's the wise old elm. The more you speak, the less you hear. The less you speak, the more you hear. always used to read that story to me. Pity she was useless at that.
Yeah.
Oh. I guess we live in a very busy world, isn't it? Where people feel too busy. People feel like they aren't able to just switch off everything that's going on in their heads and listen. A large part of listening with compassion comes from your own ability to focus, isn't it, on what somebody is saying and switch off the external noise, which is quite hard
to give someone undivided attention.
Exactly. Now that is a skill. That is something you can learn. That is something you can train people to do. There will be some people who are naturally better at it, but you can train people to do that.
Yeah, to put aside all of the things in your mind, to really fully be present for someone.
Mentally and emotionally, spiritually, you're making a commitment to listening to that person. That's step one, really, isn't it?
Yeah. Yeah, it makes me think of when I was doing psychotherapy for someone, which involved 50 minutes a week, every week, no matter what, where the space was whatever she wanted to put in it. And we spent about 4 months in silence. And in that time, she didn't want to speak about anything, but she continued to show up because there was something about having a space that has been carved out for you where someone is just there for whatever you need, even if that's silence. And that was what she needed.
Silence is an important one, isn't it? When you're listening to someone, not trying to fill those silences. Obviously what you're talking about is quite extreme in that you're spending like 50 minutes of complete silence with one another, but yeah, in conversation, not feeling the need to fill a gap with a question or with advice, you know. That's often, I think, yeah, where people can kind of stumble, I guess, in conversation, is you fall into the trap of offering unsolicited advice when that person is just speaking and then there's a pause and then you feel a need to respond. But silence is hard to, not everyone is good at being comfortable with silence in conversation. That also takes some getting used to, doesn't it?
Definitely that experience helped me become more comfortable with silence. Why is silence so uncomfortable? Dunno.
I think it's probably because we're always so distracted by something. Something always has our attention. If it's not a person, it's our phone. Silence is really, truly you being in that moment with somebody where you are not distracted by the sound of their voice or what they are saying or your response, isn't it? It is just really, truly being in that moment.
Yeah.
People need to feel useful, isn't it? You know, when people give you unsolicited advice, that comes from...
Of wanting to help someone.
Yeah. And assuming that what they want is advice, which doesn't necessarily come from a bad place, which is why I guess when Akadi talks about having compassion for people who come up with unsolicited advice, he's able to do that because he recognizes it can be from a good place.
Yeah. I think another thing with listening with compassion is also in how you respond to people in distress. And I think back to medicine or medical school where you give someone a tissue when they're crying. And why do we do that?
Yeah.
It's
But both me and you actively don't give a tissue box.
Yeah, but it's something that I had to stop doing because I was trained to do that. Because to me...
I see that all the time at work.
Yeah.
And it really frustrates me.
Sometimes people even leave the room to get a tissue.
Yeah. Yeah, I've seen that
You
before
leave
too.
someone in a vulnerable state of distress to go and find a tissue.
Do you know something I really struggle with? Is in our professional life, whatever that even means anymore, you're not really allowed to show physical displays of warmth. And I think a large part of the tissue fetching is us displacing that onto tissue fetching. Like, for example, I had a patient who cried in their ward round, and the psychologist was like, I'm just going to place my hand on you. Which is fine, like, because obviously there is a balance between doing things consensually. But if you think about medicine and mental health and psychiatry and psychology, so much of what we do and what we put people through is quite orchestrated and feels very disingenuous. Why have we decided that it is not okay for a nurse or a doctor or a psychologist to hug a patient? Why have we decided it's not okay for touch to be used? Like, we are tactile beings. Why have we decided that? And I guess, yes, on one end, people will, some people need a bit more of a boundaried approach.
But not all the time.
But not all the time. Where is the balance there? And yes, there will be some people that take advantage of touch and use that to...
But it's your own comfort levels too. Around touch with strangers, there may be your own traumas around that.
As
that
the
you're
people
navigating.
who are... As the patient?
No.
As the person.
Yeah, as the person offering to be tactile. For me, I don't have a blanket boundary, and I often ask people, do you want a hug? If that's something I feel comfortable offering.
But that's not normal, isn't it, within our field of work?
Yeah.
There is like a massive detachment. So therefore, we're then trained to show compassion in like all of these specific ways that are designed, I guess.
Yeah, but in some ways we're also sold that the detachment makes us better at our jobs.
Yeah.
Which couldn't be further from the truth.
Yeah.
Because, there are times when you break character or you see other people breaking character and it just humanizes the interaction, which has become very clinical.
I can't talk about how to listen compassionately in different areas of my life in different ways. For me, it has to be the same in all areas. Obviously, they'll like, if you're listening to your friend, you'll be more inclined to like not ask them if they want a hug, because you'll probably have hugged already, and like that's a normal thing for your friendship. So I think the physical contact is, I guess, one particular nuance that's maybe a little bit more has to be judged carefully. But outside of that, there is no separation for me between how to listen to someone compassionately at work or at home or at school or in the park or on the street,
Yeah.
To listen compassionately, I really feel like you have to be someone who is quite in touch with yourself and emotions. You have to be someone that is prepared for discomfort. You have to be prepared to sit with that discomfort, to sit with pain, to watch someone cry.
Which comes with interrogating how you were taught to show emotion as a child. How did your caregivers respond to you when you were in distress as well? So there is so much to it. There is so much work we need to do ourselves, as you say, to get to a point of listening compassionately, if that hasn't been modeled. And yeah, as you said, we are in a world of being opinionated. We are in a world of talking. I mean, here we are talking about how to listen. There must be some irony in that. How do you feel you could be more compassionate as a listener?
I think by working on my ability to focus on what someone says, because I think, I find myself very distracted in conversation, also depending on who it is. Certain people have the ability to hold my attention more than others, and I'm not sure why, but I think working on my ability to really focus, which is something I've struggled with for a few years now. Generally my focus has not been good, my attention is not good. But that is one way in which I think I could be more compassionate, is really giving someone that undivided attention that we spoke about, which is difficult to do when you are carrying a lot up there, when you are anxious about something, or you've had a busy day, or you have things to do. I really struggle with that. If I have lots of things I want to do and get done, I really struggle with giving someone my attention. What about you?
I think sitting with my own discomfort more, I would say. Because I think there needs to be a level of ease with which you can truly listen to someone without being aware of yourself. So I know in some ways we're talking about being more self-aware, but actually when you aren't aware of yourself and you're fully able to hold space with someone else, that to me is another level of listening. I'm just trying to think of, I guess, examples of
I think you just need a certain level of self-awareness. You don't need to be somebody that is, you could be anywhere on that journey. I think as long as you're prioritizing your own self-awareness, because that's what it takes to truly let go of any judgment and come into a conversation without any preconceived ideas of what that interaction will be or who that person is, or like
Yeah.
it's like being non-judgmental really is a practice, and one that people only really place emphasis on when they are trying to work on themselves. We practice non-judgment because we're trying to be better human beings.
And because we don't want to be subjected to that judgment.
Yeah.
But yeah, I guess when I say sitting with discomfort, we spoke about silence earlier, and I'm someone that is quite comfortable in silence. I'm used to listening, but if there is something we're speaking about that I'm not quite comfortable with, there is a discomfort there for me. And therefore, if you're talking about something, maybe that's sexuality, maybe that's something that I have been taught is a source of shame, and I feel some discomfort around that. Therefore, being able to listen to you compassionately is moving past my own discomfort. And that's what I mean. Like, being more open to things that make me uncomfortable will make me a better listener.
And that's, I guess, where that self-awareness comes in, isn't it? You've got to be able to think about where that discomfort comes from and identify that in order to be able to move past that.
Yeah, because there are some things that are very self-absorbing, such as anxiety, shame, these kind of things.
Yeah. Shame is an interesting one, isn't it, when it comes to listening actively, because there's a lot of things that we did not discuss growing up because it was considered shameful. And that is quite wide in terms of how many different things we didn't talk about openly growing up, which means that there's therefore going to be a lot of discomfort about lots of different things because of that shame. So yeah, I guess part of being able to listen actively also just involves you working through your crap, really, because if you can't do that, you can't let go of that discomfort or that shame or whatever it is, and that will be a barrier to you listening to people if you don't work through your shit.
Yeah, I just got a visual of like, how do we listen such that whatever comes through your mouth and into my ear, there is nothing between those things? Do you know what I mean? Like, it's almost like I just saw this image
Of like all the different things that come in between.
Yeah, in between your mouth and my ear, which are invisible. But we are all constantly navigating our own things whilst trying to be in connection with other people.
Like, for example, if I talk to someone about my parents and they have been conditioned to not question parents or speak about parents, that's a barrier to them listening compassionately. Med school needs to amp up, man. You can't be training people to listen actively
through just
giving them people a box of tissues.
a box of tissues, a bunch of generic statements, nodding your head and saying a few times.
Eye
There's
contact
more
and
to it.
verbal things. Yeah, there is, yeah. Way more. Also, listening compassionately really depends on whether you're discussing something that is specific to you and that person and your relationship, or is it something external, like them telling you about something that's happened? Because if it's about your relationship, being defensive is a massive limitation on listening. You've got to leave your ego at the door, because also otherwise you will listen like more to some things than others. Like what appears to you in a conversation or what you hear more clearly or loudly is going to depend on where you're at, isn't it? And if you don't leave your ego at the door, you might get hung up on a particular thing that person says and not be able to move past that.
Yeah. Lala's a good listener.
Is she?
Yeah.
Are you a good listener?
She doesn't speak.